pollution or the diseases because of water are classified. They're mainly classified into two. By now you would be able to tell me that it is classified into biological as well as chemical. So diseases due to water can be divided into two. One is biological and the other is chemical. Biological is known as waterborne diseases. Okay, and waterborne diseases could be because of the presence of some infective agent or because of the presence of some aquatic host. Infective agent, if you look at the infective agent, we already know which are the infective agents which are causing diseases, right? It could be a virus, it could be a bacteria, it could be a protozoa, it could be a helminth, it could be a leptospira. If it is a virus, which are the viral diseases because of drinking contaminated water? Viral hepatitis A, hepatitis E, poliomyelitis, rotavirus disease. All these are seen because of virus. Bacteria, typhoid, paratyphoid, bacillary dysentery, E. coli infection, cholera, all these are because of bacteria. Then we have protozoa, amebia, giardiasis, all these are protozoal diseases. Then we have helminth, roundworm, threadworm, hydrated disease, all these man can get through a helminth which is present in water. And leptospiral, we have only one, leptospirosis, which is familiar with everyone. We call it as Weil's disease as well. Once the complication develops, we call it as Weil's disease. And due to the presence of aquatic host, we have, aquatic host could be sometimes snail, sometimes cyclops. Okay, snail, diseases because of snail, presence of an aquatic host snail can cause a disease known as, again starting with S, schistosomiasis. You might have heard about it, that freshwater snail can cause schistosomiasis. They can act as an aquatic host. Then you have cyclops. Cyclops can cause dracunculiasis because of guinea worm. Okay, guinea worm infection or dracunculiasis. Then you have fish tapeworm. So all these are because of the presence of aquatic host. Now coming to chemical. Chemical pollutants derived from mainly industrial and agricultural waste can find its way to our common drinking water. And these pollutants include detergent solvents, cyanides, heavy metals, minerals and organic acids. Then nitrogenous substances, bleaching agents, dyes, pigments, sulfides, ammonia, toxic and other biocidal organic compounds, all these can somehow enter your water and thereby it can enter your body. And the chemicals may affect the health by either direct or indirect. Or the indirect means sometimes by accumulating in the aquatic life, sometimes in fish and all. Okay, and the effects of chemical may not be so acute. You may not see that, but what happens is little by little by little, it gets accumulated in your body. For a chronic time, it will just stay latent, causing some small problems which are not very evident, and at one point it will come out and it will give you a disease. So that is what happens with chemical.